The New Mexico Alliance of Health Councils gives sincere gratitude for the opportunity to live and work here on ancestral and unceded lands that have been cared for by our state's original peoples of the Apache Nations, Pueblos, and the Navajo Nation. We honor and respect the indigenous cultures, traditions, languages, and the rich contributions that continue to shape New Mexico today. Together, we acknowledge the history and impact of genocide, dispossession, colonization, and ongoing systemic inequities on Indigenous communities. As a collective, we commit ourselves to working towards justice and reconciliation, dismantling inequitable systems, and standing in solidarity and respecting relationships with Indigenous peoples. The Alliance affirms Indigenous sovereignty, self-determination, and self-governance of New Mexico's tribes, pueblos, and nations. In offering this land acknowledgement, we encourage everyone to reflect on their own relationship to the original peoples and traditional lands of New Mexico and take concrete actions to dismantle systems of oppression where Indigenous peoples are honored, celebrated, and empowered.
Thank you, Sam, and welcome everyone. Once again, Valeria Larcon here with the New Mexico Alliance of Health Councils. Together with our small but mighty team, we serve all 33 county health councils and currently 10 tribal health councils. And with our CCF Planning Committee, New Mexico Public Health Association, Healthcare Authority Behavioral Health Division, our health promotion team members across DOH regions, public health regions, and our friends at the New Mexico Early Childhood Education and Care Department. We come together to curate this convening in service of all of us, all of you here together in response to the priorities that you all requested from the May 5th CCF. I want to invite all of us to please join me in welcoming Governor Christopher Moquino from Pueblo de San Ildefonso, who will be sharing opening remarks. Governor Moquino is in his 6th year of tribal leadership as governor and continues to root his leadership in fairness and equity while striving for community-wide health and wellness. Governor Moquino is guided in his leadership by Tewa language and culture. He is a standout leader in support of tribal health councils, from legislation advocacy to regular participation in San Ildefonso's Health Council's activities. Welcome, Governor Moquino. Thank you for joining us today.
Ubiakindi wawatamu takiriboti ontioko tantikie navik na imbik ema Americana popo kweko popo. Good morning, buenos dias, sengitamu, ubiakindi, yatahe. It's good to see everybody. I appreciate the opportunity to briefly share some opening remarks for this collaborative effort that we wish to thank the New Mexico Healthcare Alliance and all of you that are doing tremendous and great work within your fields of behavioral health, medicine, counseling, leadership in your traditional places. It's a community-wide event. But with that, greetings from the Pueblo of Acoma, where the All Pueblo Council of Governors are holding their monthly meeting this morning. It's a great honor and blessed to be in another part of New Mexico where we are continually working on environmental health, education, all items across the board. But with that, just wanted to share a couple of remarks and thank you to the New Mexico Healthcare Alliance for hosting today's forum. I understand that there will be a series of breakout rooms to discuss the impacts of SB3, public health policies, tribal health priorities, along with gubernatorial candidate panel. I encourage you all to be generous with your thoughts, ideas, and feedback as to what healthy communities look like and what communities need in order to be healthy. When we talk about healthy communities, we also understand the variables that impact our decisions on a daily basis, how they reciprocate into one action, forcing a good or positive response. That goes from having appropriate law enforcement services, behavioral health services, interim measures when dealing with violence, domestic violence, proper nutrition, um, making sure that adequate food, homes are given to our families, but most importantly to our elderly and to our young. As we all understand, a healthy mind is able to prosper and grow within sometimes negative environments, but also is in a position to help change those negative environments and actually bring positive within that. And we've seen that through all of your efforts, whether it's in childcare, domestic violence, homelessness, leadership. And so we've all been impacted one way or another throughout these types of items, issues that affect us in the coming, in the past, currently, and in the coming years, months, and weeks ahead. With that, I also want to and allow, encourage and provide really hard questions to the gubernatorial candidates. When it comes to elections, health, and viability, safety is not a party line. We have to encourage all our elected officials, tribal officials, whether they're in the city, capacity, municipalities, to reach across party lines. It takes a mountain of people to understand and get to creating a list of burdens, struggles, a list of negative impacts that need to be seen on a wall, identified, and come up with positive solutions. And so I'm hoping that during the candidate forum, both Deb Holland and Mr. Hall will be able to provide and paint a picture of what they feel and what they see needs to be included in the next 4 years, reaching across party lines, working with our representatives and senators within the state of New Mexico, having collaborative and true tribal consultations with the 23 tribes represented within the state of New Mexico, and making sure that we look out for the benefit of all. There are so many diverse classes within the state of New Mexico, from our Spanish to our cities, to our tribal communities, to our pueblos, to our Apache friends, the Navajo Nation. And so all of these towns, whether from down south all the way up to northern New Mexico, are all important aspects within the state of New Mexico. I think we've seen the state climb in certain areas, but there's always more than enough work that needs to be conducted. And you all are part of those answers. You are part of those solutions. And I also want to congratulate each and every one of you for the effort that you continue to put on a daily basis. With that, I wish you all a safe and prosperous morning and day today. There's so many things to incorporate when addressing leaders like yourselves that have the expertise and knowledge to make impacts on people daily. But those are just small offerings that I hope that you all continue to prosper in your communities, serve our people. That's not always the easiest thing to do. And so with that, I respectfully turn it back over and wish you all the best of luck in today's meeting. Thank you.
Thank you, Governor Makino. We're so grateful for your leadership and your partnership. I know the Alliance is here in support of tribes, pueblos, and nations, and grateful to all of our friends, 156 partners joining us today on this really important and timely, as Governor Makino noted, a very timely convening given the elections and given everything that we're navigating together, my friends. So thank you so much for your leadership, Governor Makino, and for your inspiring words. from the heart. I feel it. Next, on that note, we want to bring attention, since we have over 150 friends here, we want to bring attention to a call to action in support of Zuni Pueblo. And Sam, if we can advance the slide. We have our friends from Pueblo of Acoma and others coming together for a relief support in support of Pueblo of Zuni, given the floods that took place several weeks ago. And so this Friday, my friends, is the last donation date at Sky City Casino, where you can drop off various necessities that our community members there need, from cleaning supplies to toiletries, and so much more. And Sam will drop in that flyer in the slide deck as well. And also, given the frijoles fires that are fire. I mean, it's significant fire that's, everybody's doing their very best to contain. We have fire information here for the Pecos area, Nambe Pueblo, and surrounding areas to please stay informed. Thank you. Thank you, Sam. And if we can move on to our next slide, we want to give you a quick highlight of the agenda for today, my dear friends. And this is our convening today is in response to the feedback we gathered from all of you from the May 5th Community Collaborative Forum. A lot of you asked for us to dive into the work, to dive into these 4 key areas. Social determinants of health remains a anchoring and shared goal that we have across our state. And so we have partnered with Project ECHO to come together with all of you who are interested in a deep dive of social determinants of health framework, with how to align efforts, how to address these key priority areas. The second one, we have our friends from the Healthcare Authority to give timely updates on SB 3, Senate Bill 3, Behavioral Health and Reform Investment Act of 2025. Currently, the Executive Committee of SB 3 is reviewing and approving regional plans. So our friends from Healthcare Authority will provide some timely updates on that. We also have friends from Think New Mexico who are going to give us some highlights of emergent public health policies as we get ready for the 2027 legislative session. And so an informed population, right? All of us understanding what we're navigating together and what are those emerging public health priorities, the more empowered and informed we are to take action. And we're also going to create, obviously, a space in support of tribes, pueblos, and nations so that they can highlight what it is that they want to link arms and collaborate and work towards together that's most relevant to tribal communities. Then we're going to come back together, take a 10-minute stretch because we realize it's about 3 hours together. And then we're going to report out from each of these breakout rooms. And as we know, right, this space is essential for learning from one another, for breaking down silos, for aligning efforts to enhance our local capacity for serving communities more effectively. So this is all about collective action, my friends. We're in this together. And so we're going to take time to report out on each of these topic areas. And then we're going to pass the baton to our public health panel moderators, who are going to connect with Stephanie Garcia-Richard, who's also representing Deb Holland, and then Mr. Greg Hall and Senator David Gallegos, who are going to answer some community-based questions that emerge from CCF members, county and tribal health councils as well. And then we'll have our friends from from New Mexico Early Childhood Education and Care Department providing highlights, updates on access points for universal child care and also opportunities for workforce development. And so if we move on to the next slide, Sam, I want to invite us all to anchor ourselves, right, as we come together today, 165 strong, anchor ourselves into this question of reflection. What collective actions can we take together today to improve community health and well-being? What we know to be true is that when it comes to public health, the health of our population, it is not compartmentalized, right? We all have a piece to this safety net that supports all of our community members. And so given the moment that we're navigating together with so many changes that are happening, it does demand our collective attention, clearly, and our collective action, my friends, right? And so with that, I want to invite us to reflect, right? Who is in the room right now? And as we look at the registration, 351 for CCF today, when we look at this pie here, I see community members, I see friends. And yes, we are sectioned out into these various sectors, right? And so when we think about reaching across the aisle, as Governor Moquino said, or sharing knowledge or sharing a resource or aligning efforts, let's look at who's in the room. We have our friends from higher education. We have friends from philanthropy sector, from tribal partners and tribal leadership, from our New Mexico government and legislative body and New Mexico delegation. Our general public is here today, for-profit sector, state agencies, county and tribal health councils, who are the representation of our diverse community members, community coalitions, nonprofit sector. And so, yes, we are all working within these various sectors. And today we have the powerful opportunity to come together, stand with one another, share resources, strengthen our collective capacity, and ensure that every community feels supported, informed, protected, and cared for. So let's also give a quick highlight, because people continue to ask, and I think it's important for us to anchor ourselves into this purpose of CCF. At the heart of CCF is breaking down silos by exploring alignment and identifying collaborative opportunities for serving communities more effectively. So let's take a look who's in the room again with a little bit more context. State agencies, we have Department of Health, Healthcare Authority, Indian Affairs, early childhood education. Our tribal representation here, we have our friends from Fort Sill Apache, Okeowingi, Pueblo of Zia, Pueblo of Laguna, Pueblo Alamo Navajo School Board, for example, Pueblo of Taos. My dyslexia kicked in there a little bit, apologies. Pueblo of Zia, and many organizations that support tribes, pueblos, and nations. Big shout out to our congressional delegates, the Office of Representative Teresa Ledger Fernandez, Ben Lujan, and so many more. Our legislative bodies here to listen from their constituents, right? We're in this together, my friend. This is an opportunity to make your voice be heard, to really do a little bit of a deep dive on what is needed from a community perspective and lean into each other. The greatest asset that we have is one another. We have the wisdom of our elders, the lived experiences of our diverse communities, the strength of our tribal leadership, and sovereignty. We have our health councils, behavioral health local LCs, ECE coalitions, our legislators, and so many more, bringing knowledge, resources, and passion to this work. Woo! I'm fired up, my friends. Are you fired up to be here? I'm deeply grateful to all of you. Thank you, thank you, thank you. So let's do, I can keep going. I'm a Latina, I can definitely get into the weeds, but because this moment calls for all of us, right, to link arms. You're gonna make me cry with all those hearts. It's been a time, my friends. Let's together take a stand with one another, with New Mexico. And today, let's turn these ideas, these resources, these alignments, right, into collaborative actions. So Sam, if you can take me to the next slide. Again, these are the breakout rooms. Hola, Guillermina. These are the breakout rooms in response to the request that we received from all of you from the CCF in May. My friends, we are stronger together. And so we're going to invite our facilitate our next slide, Sam, to highlight our facilitators who are going to be supporting you during these breakout rooms. We'll have Jessica Osenberg from Roadrunner Food Bank supporting our friends, Project Echo, in the SDOH room. We'll have Also, Sam Winter, Socorro County Health Council, supporting SB3 breakout room. And we're going to have Emma McKinley from Grant County Health Council supporting, I think, New Mexico emerging public health priorities. And then, of course, yours truly and Geraldine Antonio, who is going to be in the tribal breakout room. And please know that the main room, we're going to focus on, we're going to keep SDOH, how to address social determinants of health, in the main breakout room, where we're going to have ASL interpretation and Spanish interpretation. So just wanted to note that this main room is the one that is going to have the interpretation. Also, because we have all your attention here, 166 strong, we want to do a little pulse check, my friends. We want to check in with you as to what brought you in today, what's most important to you. And so Sam has pinged a little Slido polling, so poll question. So if you can kindly click on the open, and let's take a couple of minutes to reflect and share what brought you in today. This is a powerful moment, powerful space. We're stronger together. And this is the space where we can link arms, right? For building a healthier, more equitable and thriving New Mexico. And not just for today, for now, but for generations to come, my friends. And so this is going to be super easy. And they're also, the polling questions are also available in Spanish. Am I echoing, Sam?
A little bit, you started to echo, yes.
Thank you, Sam. Thank you for unmuting me. Okay. And so, Sam, if we have some feedback, I think we're at 36, just to kind of give a reflection of what brought us together today. If you can sort of cherry pick some input. They're all anonymous, my friends. We want to learn from you. We want to serve you. We want to curate this space in response to your needs. This is your space.
So just looking to hear, what's going on locally, hear from our gubernatorial candidates. The topics are really intriguing today. Connect with their health council, become informed on what's happening across the states, get updates on behavioral health Reform and Investment Act, continue learning, connect. A lot of things we're seeing, breaking down silos.
I'd love it. We're aligned, my friends. We're aligned. So why don't Sam is going to, and people are continuing to arrive. We're 168 strong, my friends. I'm so touched and encouraged and empowered by all of you being here today. Sam, are we ready to launch the breakout rooms? Anything else that we need to touch on before we do breakouts?
No, I will open them, and then just a reminder, this will be the social determinants of health, and this is where we will have our Spanish and ASL facilitation occurring. So you may choose your rooms now, and we'll drop in the chat if it didn't pop up for you, how you can join your breakout room.
So we'll give folks a minute to please self-select your breakout rooms, and Sam and I will be in each of the rooms, also seeing if there's any support that's needed. But yes, please self-select your breakout room. We'll see you here in an hour, my friends.
Wonderful. Thank you.
Thank you so much, everybody. We'll see you here in just a few.
They stay strong, rolling till the nighttime blazes on. All along, I keep singing my song. I say, this phase is always something sometimes I get so crazed, but just know that I'll always stay, cause you're my light through the haze. It's time for a champion, soothe the soul of the land, mend the heart from the sea and sand, till the sun comes up again. Time for a champion, soothe the soul of the land, mend the heart from the sea and sand, till the sun comes up again. Reach for the sky, keep your eye on the prize, forever in my mind, be my golden sunshine. It's raining in your mind, so push them clouds aside, forever by my side, you're my golden sunshine. When the sunset, I let myself down, down the ground beneath my feet gone. No more words with it to speak. On that day my song was born. Never meant to leave you all alone. Said I'd be a shelter from the storm.
That was the fastest break ever, team. Thank you so much. Welcome back, everyone, from the breakout sessions. Again, just for our friends who just joined us, these breakout sessions were curated in response to CCF members' requests from the May 5th Community Collaborative Forum that we hosted in Albuquerque. Again, my name is Valeria Larcon, Executive Director at the New Mexico Alliance of Health Councils, together with our small but mighty team in support and service of all 33 county health councils and currently 10 tribal health councils. And I just got to say again how deeply encouraged I feel by all of you being here today, by your dedication and your collaborative spirit. And as we know, when we break down silos, right, when we share what we know, when we aligned our resources and efforts, and when we work across sectors, we can create something very, very powerful, more than any one organization can do alone. So we're stronger together, my friends. I am going to turn it over to our breakout room facilitators who are going to report out on each of the breakout rooms, which includes addressing social determinants of health, the SB3, Behavioral Health and Reform and Investment Act updates, public health policy priorities, and of course, tribes, pueblos, and nations, tribal space, and what they identify as most timely and pressing for them. So I will turn it over to Geraldine Antonio.
Okay, cool. I'll go ahead and kick us off. I'm gonna just share out. I know we were ended just a little bit early, so I will hand off. I think Ophelia and Takoya also may have had some additions. So for us around priorities, it was really awesome to hear. We got to hear from some of our tribal partners from the Pueblo of Zia, San Ildefonso Pueblo. We also heard from DOH, the epidemiology department, tribal epidemiologists, Pueblo of Cochiti, San Juan Partnership. We also heard from the U.S. Department of Justice, and if I'm missing anyone, Lanel Foundation as well. But we had a really good discussion around alignment. And so I'm just going to touch on some of those, but overdose prevention, Narcan training, stigma, and toolkits, and then a big focus on polysubstance use and harm reduction. Another being suicide prevention as well. Diabetes prevention and management was another priority. Elder caregiving resources and caregiving support and services. We also had children and youth services, missing murdered Indigenous people, and with a focus on internet safety and prevention for the youth. We did hear from DOH about some DOH data dashboards. And so they're currently meeting with tribes, pueblos, and nations now to create those templates and gather feedback for the dashboards that is currently in progress right now, and a need for technical assistance for tribal programs from state partners. So those are some of the alignment opportunities that we focused on. But even further, we were just chatting about maybe how to move forward with those alignments, whether that be knowledge sharing, funding opportunities, or linking arms. And then we kind of cut out for a bit there, but we had some good discussions around opportunities. So for us, we had one of our attendees ask, what resources do we have for the worker bees? So those on the ground doing the work. How are we supporting them and helping them navigate self-care? And we did get to hear from former Governor Norman Chiate from SUNY Pueblo kind of talk about self-care, what that could mean, on the tribal aspect of cleansing, prayer, humming, drumming, maybe even talking circles, Tai Chi, or just walking and getting some fresh air. And so chatting a little bit about that. And also, we had some of our partners talk about self-care and how they do self-care. And a lot of the times when providers or those working in the community, they can carry trauma, see things that are unexpected, or maybe carrying what others are feeling. So maybe like energy transfers, how we can support our providers and those working on the ground to care for themselves and also heal, restore themselves, energize themselves. There was conversation a lot about providers maybe having time off, medical leave, sick leave, mental health days, but that still not feeling enough to really get someone through the day or through the week. And so how do we really support those who are doing the work? And so we did get to hear a little bit from some of our partners about a retreat and a men's group. And so it was really awesome to hear about some of the work that San Ildefonso is leading in terms of a men's group, just because they feel like, generally speaking, women typically have more support. And sometimes on the men's side, it can feel punitive, as noted. So how do we support some of our other populations who may be receiving less support? And I am going to pause here because we had an amazing group. We had others who wanted to still share and provide some comments and feedback. So for those in our tribal work group, feel free to unmute and provide some information if I missed any.
Maybe they included in the chat just to double, triple check.
Desiree.
Mm-hmm.
Awesome. Yeah, so Desiree Martinez is the DOH tribal epidemiologist. Desiree, would you like to share out what you put in chat here?
Yeah, I have to head to another meeting, so sorry. But my name is Desiree Martinez. I'm the tribal epidemiologist at New Mexico Department of Health. And we are currently in the stage of just developing the template, gathering as much of the data that Department of Health houses, and making sure that we can get it out to each individual tribe, the data that they need. Yeah, that's kind of the process. And then we're hoping in the next few months to reach out to the tribes, each individual tribes, to get that going, hoping to include all the departments that might need that data for each of within the tribe, to make sure everyone's included and get the data they need that DOH houses. So yeah, that's kind of where it's at. It's in the development stage right now, doing a lot of data cleaning and trying to make it sure it's, as accurate as possible. Yeah, but feel free to reach out. I'm so sorry. I have to head to another meeting, but my email's in the chat if anyone has questions.
Awesome. Thanks, Desiree. And also congratulations on, I was reading about the news with the MOUs and Navajo Nation. So yeah, I just wanted to do a shout out for DOH and some of that successful work happening right now. Um, all right. Did I miss anything from our tribal work group? And if not, I hope I captured everything well. There was a big conversation about tribal leadership too, and just keeping our tribal leaders informed. I know we touched on a little bit of consultation, but more importantly, how can programs and departments keep their tribal leaders informed? Um, so that way health is a priority, from the tribal leaders as well. And also how we can use data and some of the information we're collecting to share back to our tribal leaders. So I think I might have missed that. And then Sequoia, another opportunity to connect with each other. Yeah, I think we had mentioned that we could definitely reconnect with our tribal work group after if we want to continue our discussion. And that might conclude from the tribal end, unless others want to join. So thanks so much.
Thank you. Thank you, Geraldine, and to our tribal partners for giving voice to what's most timely and pressing. And yes, we can definitely follow up to create that space to continue that conversation. Up next, I want to invite Sam Winter, Health Council Leadership at the Socorro County Health Council Scope. Sam, where are you? There you is.
And I'll find the tile. But perfect. Thank you so much. Thank you to everybody in our room. Our room was very informative. We had a really, really wonderful presentation from Bianca. We were really focused on the SB3 and kind of what's happening with the Berea projects. So I'm just going to kind of give a couple of little updates based off that presentation, and then talk about some of the different questions. So there is going to be a quick note for everyone, a unified website with all the Berea information. That is going to be amazing. Housing the AOC and HCA information all in one place. Another really wonderful update for all of us working with our accountable entities and our SB3 regions. There is regional teams now. So there are regional coordinators that will be on the slide deck, but I took a quick snapshot of that. I'll drop that in the chat for everyone so that you all have that information. There was definitely a lot of discussion, a lot of questions regarding the process, kind of where everyone's sitting with the regional plans, how that is flowing through the executive committee, and then what that looks like in terms of contracts, and then how the funding is actually going to be dispersed. So I think there was 12 regions have submitted their plans. Those are in the process of being approved now. There's going to be another executive committee meeting on September the 2nd. There was a lot of really, really great discussion about kind of what happens after that as far as those contracts. It was a really great point that was brought up about how, we're very much shifting the processes now where the communities are telling the state where they want this funding to go, how they want it to be allocated. But that does mean that there is some uncharted territory with that. There was definitely some things brought up in the questions and discussion about how we need to follow the accountable entities procurement processes as well once that funding is dispersed, and how that can be a little different for each region. There was tons of questions. I would like to apologize to our room that we didn't have a chance to get through all the questions. So in our Canva board, there was a lot of really, really great questions as well, about how we're incorporating like children and youth who aren't justice involved into this system. How are community organizations being involved in this system, as there isn't specific language for that involved? What kind of evaluation measures are going to be used, and how the regional coordinators are going to successfully track these processes. Then there were some others about what the contracting phase exactly means, and whether this is going to be, the funding is going to be dispersed to the counties as one lump sum or monthly, or if it was going to be in yearly disbursements. So we had a bunch of really, really great questions, both in the room as well as on the Canva. A lot of really great things that unfortunately we just didn't have a chance to get through. But I applaud everyone for speaking up and sharing their questions and voicing some of their concerns. We do have a lot of that on the notes page as well as on the Canva. So overall, really, really great discussion. Wonderful information was shared. And again, I thank Bianca for being willing to provide us all this information in that wonderful slide deck. So thank you.
Thank you so much, Samantha and Bianca and friends. I want to invite you to the CCF online hub, because if there were questions clearly that you've been able to capture during the breakout room that we can streamline through the hub, that's a great way to stay connected, informed, resourced, up to date on what's happening, not just with SB3, but we share an array of resources, grant opportunities, public health guidelines that come out of DOH and many other partners. So we'll share that QR code here in a little bit, but we can definitely streamline those questions, Samantha, through the CCF Hub and have our friends Bianca from Healthcare Authority answer those questions and continue on that conversation. And I encourage everyone to please join the SB3 Executive Committee meeting, because that is where you hear from the folks who are, leading this whole process together with the 13 regions on what's, on those timely updates and guidelines and approved plans and so forth. So maybe our friends, Amy Sandoval from Behavioral Health Division and Bianca from the Healthcare Authority can include that link where folks can find access to that upcoming September SB3 Executive Committee meeting. Thank you all around. These are tax dollars at work. I'm going to turn it over to Emma McKinley, Health Council Leadership from Grant County Health Council. Go, Emma.
Hi, everyone. We were the Emergent Public Health Policies breakout room, and we had a wonderful presentation from Think New Mexico. Think New Mexico is a results-oriented think tank serving New Mexicans. It is bipartisan research and advocacy, doing lots of great things to help address our healthcare worker shortage in New Mexico. And so we had Mr. Fred Nathan, who is the founder and executive director, and we had Lauren Leland, who is the director of healthcare reform. And they presented us with a ton of really interesting information, some of it harrowing information about the ways that we are lacking, but also very hopeful information about the steps that are being taken to help address this. And so they let us know that in the years between 2019 and 2024, New Mexico lost 248 doctors, which is 8.1%, a decrease of 8.1%, while the United States as a whole gained 44,272 doctors. And so while, oh my gosh, I'm sorry, my dog is being cranky. So while the United States is getting more doctors, New Mexico itself is getting less. And 32 of 33 New Mexico counties are considered health professional shortage areas. And through our discussions, we discovered that like the lived experience of that is that actually all of them are health professional shortage areas. Because the one county that is considered is considered not to have a health professional shortage is Los Alamos County. And folks living in Los Alamos were saying that, well, there is still a shortage. It still takes a really long time to get in to see a doctor. There's not really any specialists. And so while the data is saying that 32 out of 33 counties are shortage areas, lived experience says otherwise. All of us are needing more medical professionals. So what is being done about it? Many things have already been done. So Think New Mexico let us know that a permanent trust fund has been created for Medicaid. And in the last year, through House Bill 99, really meaningful medical malpractice reform was able to be put through the legislature. So hopefully health and the different like liability insurance becomes less of a burden on our healthcare practitioners. We also joined a licensure compact for doctors, which means the doctors don't have to be relicensed when they relocate to our state, making it easier for healthcare workers to come and work here. Enhanced our loan repayment program to help make it be more affordable to be a doctor, as well as passed a $10,000 physician tax credit. So those are all really big wins for helping recruit and retain medical professionals in New Mexico. And yay, Chara, I see the little party horn and the hearts. So that's all very exciting. And so what's next is trying to push through and have New Mexico join 8 other licensure compacts for other healthcare professionals. The licensure compacts that we're a part of now are for nursing and for doctors, but there are other healthcare compacts that could allow dentists and dental hygienists to practice in our state without relicensure, EMTs, as well as a variety of other healthcare professionals. Tax reform is also something that Think New Mexico is working towards. We are the only state that has a gross receipts tax on medical services, and so working to help alleviate that burden, as well as enhance funding for that Medicaid trust fund to help make sure that vulnerable New Mexicans can continue to be covered, as well as expedite pathways for international doctors to practice in New Mexico. Create a centralized credentialing system to help make it easier for medical professionals to be credentialed, and then grow more of our own healthcare workers so that we can help bring about the future of doctors. And so that's all really exciting things that are going on. Think New Mexico did share their action center with us, where you can go and find different scripts for making ACT. Oh, and Lisa Hampton's in the chat saying the social worker compact was also signed this year, which is very, very exciting. Anything that makes it easier for, these licensed, educated, knowledgeable, compassionate professionals to come work in our state without undue burdens is a major win. New Mexico is my favorite state, so I'm always trying to convince people to move here, especially people that are professionals that we need. So those feel like the main things that we learned in terms of opportunities to collaborate. I did post in the chat that action center where you can go and figure out what Think New Mexico is working on next, make asks of your elected officials to help push these things through. Yeah, we need a lot more all over the state: cardiologists, neurologists, pulmonologists, behavioral psychologists, and surgeons of all organs. We definitely need more specialists. I go out of state for several of my specialists, and I would love to be supporting, New Mexico doctors, but it just isn't realistic with the current landscape. And so making it easier for professionals to find, meaningful work here. Will all of these provider network initiatives and milestones be shared? Documenting all of them is a challenge. Yes, documentation can absolutely be a challenge. And the different initiatives are highlighted on Think New Mexico's website. And this is something that we can make sure that we, as the Alliance and as health councils, can be checking in on as well, and making sure that we're sharing out in order to highlight this important work. Does anyone from our room have anything else they'd like to share? Oh, and Sam is saying, Think New Mexico's priorities are also listed in today's resource guide. Yes, I will paste the link for Think New Mexico in the chat. So there's the link to their homepage. And here is the link to their action center.
And
Kayla.
Emma, if I can just chime. Oh, I'm sorry, I'm cutting somebody off.
Sorry, I saw Kayla's hand, but
No, I just wanted to say I'm Lauren from the Think New Mexico team, and I really appreciated being able to have a conversation with us, all of us in the breakout room. And yeah, thank you for putting the resources to our website and our action center and everything online. And also feel free to email me, anybody, if you would like to know more about the work that we're doing on the healthcare worker shortage. My email is just lauren@thinknewmexico.org, and I'll put that in the chat. We're on all the social media platforms. So if you're wanting to follow along, we're there. We're trying to make all of our agendas as accessible as possible. So feel free to contact me.
Awesome. Thank you for putting that in the chat, Lauren. And I see it down there. So folks, reach out to her if you have questions, comments, or ways to help. And Kayla, I see your hand up.
Thank you, and thank you for that great recap of that discussion. I just wanted to share a question that I had asked Lauren and Fred, just in case others were wondering the same thing. My question was in regards to House Bill 99, the medical malpractice changes. So I asked, since House Bill 99 went into effect in May, will those medical malpractice changes be applied retroactively to cases filed before the effective date, or is this something attorneys will need to argue in court? And Fred did say that because there is a constitutional provision that prevents retroactive application to cases filed before the bill's effective date. And Lauren, sorry to put you on the spot, but I would love it if you could share with our audience what you shared with me in terms of what Think New Mexico is doing to monitor the amount of medical malpractice cases leading up to the bill's effective date, and your plans afterwards.
Of course. I mean, one of our questions is the bill going to work? Is it working? So we're trying to track the data of how many cases are filed. I was tracking the data sort of day by day leading up to the changeover, which I think was May 20th was the effective date. We don't have any real conclusions to draw from that at the time right now, because we need to look at historical data and also compare it to, say, the numbers next year. So we'll see how the effect that it has, but we're tracking the cases and we're tracking the doctors, right? Those are the two main things that we're really watching for out of 99, as well as the insurance rates. So we're really going to be following up, making sure that what we want to see happen is happening. And yeah, so follow along. I'm sure we'll put updates on our websites and social media and everything as we can sort of see the work happen. So thank you for your question, Kayla. It's an important question. And of course, we can't just pass the policy and say done. So we'll be following up with that.
Beautiful. Thank you, Lauren. Thank you, Think New Mexico, and all of you for your advocacy efforts. We're going to turn it over to Jessica Osenberg for reporting out on SDOH.
Yeah, thank you, everyone. And a lot of the topics that had the other breakout rooms had discussed also very much frequently came up in the social drivers of health breakout room. So we received a nice presentation from Andrea Zarowski with UNM Project ECHO, titled Collective Action for Health, Addressing Social Drivers of Health. And we really discussed that the social drivers of health are the conditions in which we were born, grow, work, live, worship, and age. And the group wanted to answer some questions which were centered on what are the key social drivers, who is already doing this work in New Mexico, and how can we join efforts to amplify the impact. And then we launched into some discussion amongst each other about supports and barriers for New Mexicans in social drivers of health. And we really had a lot of thought and contribution to our nice whiteboard around all this. And most certainly, and bear with me as I'm just kind of pulling out some themes on the Canva board. But we wanted to talk a little bit about the supports, and some supports that were called out are family and culture, collaboration with the New Mexico Alliance of Health Councils, and legislative focus on physical and mental health. Some other supports were SNAP and Medicaid and food banks and all these kinds of entities that are really helpful in community in addressing social drivers of health. And oops, my apologies, my Canva board just blipped out here a little bit, so I've just lost my board. So I'm going to try to say this off the top of my head. We also talked a little bit about some of the barriers in social drivers of health, and we discussed the points of transportation and access to care with 248 doctors that have left the state. That certainly highlights that there's issues, right, in accessing care. It's the ability to access food. So those were some of the barriers that had come up in sort of the conversation around social drivers of health, and what are the assets, what are the barriers. We further discussed the domains of social drivers of health, which include education access and quality, healthcare access and quality, neighborhood and built environment, social and community context, economic stability. And some of the attendees within the breakout room identified the ways in which their organizations and programs are already working in various programmings, highlighting specific services or approaches. And I'm going to try to see if I can get my Canva board back up here so I can talk a little bit about that. Bear with me for a moment. Okay, I think I got this here. So we had some groups talk a little bit about what they are focused on. There's the Paso Network, EC Coalition working on education access and quality, health care access and quality, social and community, and that this work is really interwoven with systems change. The Clone Alma Health Foundation called out that they are doing some specific work on health equity. The ECECD called out that they are focused on education access and quality and economic stability via childcare access and universality. Care Suite, an electronic health record system, and much more for community, is really working on support and enabling community health workers, doulas, community health representatives, and promotoras so that they can achieve reimbursement through the managed care plans for all the social drivers of health and barriers that they are addressing with the populations that they are serving every day. The Mexico Office of African American Affairs called out that they're working on health, diabetes, and heart health, health equality, equity, education, and economic disparities, nutrition risks, education and awareness, maternal challenges, policy advocacy and reform, and much more. The health councils definitely were calling out access to care and basic needs, resource navigation, closed loop referral systems, connecting residents of their community to food, housing, utilities, healthcare, transportation, benefits, and other basic needs. So some really good focused areas within those social drivers of health that are domains that are being addressed. Furthermore, in the conversation, we discussed opportunities for collaboration, which includes prevention, workforce, data, access, policy, care coordination, partnerships. And we walked through a little bit of some examples of what that could look like. So we walked through some examples about how a community health worker might be within a community health center or a community-based organization, developing and implementing a diabetes prevention program, or a library and a health system providing telehealth services. And we lingered on that point for a little while and discussed the Rural Library Initiative, a health hub for rural areas that are providing telehealth desks, and sometimes speakers and educators that are coming in to focus on education, awareness, and community discussion on health topics, such as insurance or how to eat and live well, and in managing diabetes. So this is an area that the breakout group really wanted to dive into about leveraging and partnering with rural libraries that tend to be these health hubs in a community, and working with community members when there may be with shortage of doctors, right, and some of the infrastructural kinds of issues that occur in rural and frontier communities, that there's not always a nearby clinic or a healthcare provider to receive this information from. We also thought that maybe in the libraries that there could be some materials about the specific health issues to help individuals learn about the health issues that they may be managing, to help them make decisions and priorities about the health issues that they are managing, either for themselves or somebody in the household. Really getting at the heart of health literacy and helping New Mexicans with that kind of information and decision making that oftentimes comes with managing health. We also discussed a little bit the statewide closed loop referral system. Yes, New Mexico Connect and its key partners, 211, Share New Mexico Alliance Health Councils, a lot of the healthcare organizations, the community-based organizations, nonprofit organizations is a really good example. And as well as how a food is medicine program may be implemented with services with local agriculture and a federally qualified health center, or local ag aggregators, the food hubs that we have around the state. So there's some really good examples of how this is already occurring, or what maybe could be advanced forward, so that there is good response to social drivers of health of the community and population, particularly the adverse social drivers of health. And then we had a little bit more discussion amongst each other about some of the health collaborations that are already underway, and what has worked well and what has been some learning lessons. And there was a good many sparks of inspiration, as I always say in this conversation. And a point I wanted to raise first, that was sort of at the end of the conversation, was really centered in rural communities, the community-based organizations or the healthcare organizations, that it's sometimes very difficult to attract the workforce, whether it's the clinical roles or the non-clinical roles. Sometimes there's some support and help that's needed with just technical assistance for grant writing, or working with funders and donors, if not decision makers in this work, and some of the administrative work that needs to happen, that there's a lot of training and technical and kind of capacity building that maybe really needs to happen in rural communities. And so there was that aspect. And going back into my Canva board, bear with me for a moment. There was some other really good thoughts in here. We had some identification of who the attendees or partners within the group were already collaborating with. There was a call out on the Department of Health, Office of Alcohol Misuse Prevention, healthcare and behavioral health partners, substance use prevention programs, tribal and local government partners, social service organizations, state agency partners, the Mexico Social Drivers of Health Collaborative, which I know many of you participate in, the Bernalillo County Home Visiting Group, many partners in here, the technology vendors that have closed loop referral systems, Find Help, Unite Us were called out, food security partners. So there's a lot of collaboration that is already happening in New Mexico. And then we talked to what are some apps for collaboration, and what has worked well. And as we sort of talked through this, There was some thinking a little bit around getting cross-sector buy-in by offering opportunities to help other organizations. Definitely some thoughts a little bit about maybe further collaborating with United Way's ALICE program, ALICE Asset Limited Income Constrained Employed, which now has a new report that has come out, really focusing and highlighting on New Mexico's communities. Definitely a shout out for just show up and continue to show up to offer support and keep lines of communication with partners open. There was some identification that there's been some things that have worked well in collaboration around harm reduction, polysubstance use, overdose death rates, and community education. And then there was some lessons a little bit about going out to rural areas to take resources to neighbors who don't have resources to come into town, particularly in the areas that they reside in. Definitely a lot of focus on rural health. So Kayla, I'm definitely thinking there's some good nuggets in here for the New Mexico Rural Health Association. And then we talked through a little bit about in this work of addressing social drivers of health that there's a real desire and a need and maybe something that really can be deeply pursued with partners who are working on it to really move this towards a real strategy focus on systems transformation, understanding root causes, and doing something really meaningful about these actual root causes and the drivers for a longer term. And it was pointed out that the Black Leadership Council is working on this, as are other groups. Right, and that was really sort of the highlights of the conversation. And as we continued, we just really wanted to pinpoint where the collaborations and the partnerships could take place to align and amplify in efforts, and to continue opening that space and that discussion amongst each other. And I've seen some folks post that comment in the chat. Let's continue this conversation. We are better together in New Mexico when we are collaborating and working together with each other, and not making it feel so competitive in any way with the funds and the resources and the capacity building. And I can definitely say that even in the work that I've been embarking on at Roadrunner Food Bank, we're really having a good focus on our rural food bank partners who oftentimes maybe don't know how do I write that grant, or how do I start on this, or connect to funders, or connect to these kinds of groups. I'm just kind of building that capacity, and that's even something we're focusing on at Roadrunner Food Bank. Is there anybody else from the group that would like to chime in or offer anything additional?
I'm happy to real quickly. Sorry, let me get my video on. Real fast, because I know we only have about 1 minute left. I thought something that was really helpful for me, because one of the things I talked about was how hard it can be to collaborate when you can only work in a certain area. And so, Andrea was the one that suggested that collaboration doesn't have to look like working specifically together, but learning from each other's mistakes and learning from each other and what we're doing in our different areas. And so I thought that like really opened my eyes and my brain into like, oh, these are other ways we can work with organizations around New Mexico. And we don't have to just focus like, oh, I can only do this in Rio Arriba. I can talk to somebody in like Sandoval County about this thing that we might be doing similar things with. So I really appreciated that too.
Thank you. Thank you, my friends. And on that note, we're going to be sharing, and Dr. Aldrich, I see you. Go ahead. Go ahead. very
I
quickly.
just wanted to thank Andrea for her great presentation, discussion, and from Project Echo. I acknowledge all the good things that she shared, as well as the great summary that just was presented.
Beautiful, Dr. Aldrich. And please, all of you know, 173 strong today, multi-sector partners, you're going to have an opportunity to continue these conversations and moreover, take action through the CCF Hub. Thank you to all of our partner presenters today. I am so encouraged and empowered by the collaborative spirit here, because these are areas, right, of alignment that can increase our local capacity, not just responding to current challenges or unprecedented times that we're navigating together, but to build a strong public health infrastructure and one that is agile and adaptive, my friends. So grateful for all of you. Next, we're going to have our dear friend, Jose. Where are you, Jose, from the New Mexico Early Childhood Education and Care Department, who's going to share some access points with regards to universal child care and so much more. Thank you, Jose.
Thank you, Valeria.
Go for it, my friend.
All right, thank you, everyone. Should we jump right in? So good morning, buenos dias. My name is Jose Gonzalez. I am a Family and Community Engagement Coordinator with the Early Childhood Education and Care Department, best known as ECECD. Today, I'll be presenting to you on universal childcare and supply building. Next slide, please. Thanks, Sam. Okay, so the following are our learning objectives for today's presentation. One, we're going to go in depth and recognize the legislative impact of the Child Care Assistance Act as it codifies the Child Care Assistance Program in New Mexico. Two, we'll be discussing and understand the key components and goals of universal child care. Third, identify major changes to the Child Care Assistance Program and processes for families, including eligibility and documentation updates. Learn about the child care supply building efforts. So we heard a lot of good feedback from the CCF conference May 5th in Albuquerque. So we put a nice presentation for you all. So let's dive into Senate Bill 241, which is the Child Care Assistance Program Act, officially became law May 20th of this year. And we've seen such an incredible growth since its inception, November 1st of 2025. So this law puts that certainty out there to the communities across the state, codifying the child care program. In addition, providing the long-term sustainability and accountability of the universal child care, this law also indicates that over the next 5 years, and up to 5 years actually, the legislature can appropriate up to $700 million from the Early Childhood Trust Fund. The other great thing it does is waives co-payments for all families still, so there's no cost for childcare. But if there is some kind of economic downturn that's outlined in the bill, then families over the 600% of the poverty level will have to pay. The department will have to put also co-payment structure in place, and it also requires that if we have to do a wait list or co-payments, that we have to prioritize young children, families under the 400% poverty level, and children who are at risk or who have developmental delays and disabilities. So the other great thing that the federal law also requires, it's two methods to set their rates. So in this bill, we have codified that for New Mexico, we use a cost estimation model, which helps us understand the true cost of delivering care for kids, and that it helps us inform our rate setting, And as we saw, we have implemented the final rule last year for universal childcare. So there was a significant increase also in the rates, even from our proposed rulemaking to the final, because of the feedback we have received from a lot of providers, from a lot of you, and from a lot of advocates. So we've heard you, and we have codified a lot of this feedback, a lot of the suggestions into the Child Care Assistance Program Act. Next slide, please. So the Senate Bill 241 also has a lot of requirements around better coordination between child care and early intervention services. So this holds a lot of accountabilities for the department to collect data from childcare programs, analyze how their business are structured and what their debt is, and analyze also where their revenue sources are from. So childcare providers are required to inform ECCD of their hours of operation, how many days of a calendar year their programs are open. And it's because it's important for us to understand how families are getting access to care. You know, if it's 12 months of the year that they're accessing the care, most of the days of the month, or as they need to go to work or pursue their schooling or other goals as well. So, and then providers are required to report to us by July 1st. I know we're past that deadline. Some data that we're working very closely with the community, but also our internal systems to make that reporting as easy as possible. And lastly, ECCD must report to the Legislative Health and Human Services Committee and the Legislative Finance Committee by September 1st of what came off of those findings and the data collected from childcare providers. So this level of transparency allowed the department to continue advocating to serve families and children and ensure we're also supporting the facilities and the staff caring for our kiddos. So we want to understand the type of settings that they have, the quality of care, and by also assess the race and ethnicity, income levels of children that we're serving across the state. So those are different factors that really is going to provide us a lot of great information for the department, but also to our policymakers as we continue to grow this incredible system here in New Mexico, because we're the first state in the nation to offer universal childcare. Thank you, Sam. Okay, so moving us along with the snapshot of the universal childcare data. So the following breakdown is the most updated data that we have. And as you can see, we're on the right track. Since November, thousands of children and families have been newly qualified for childcare assistance, bringing our total children served to almost 21,000. And that's across the state. So that is huge. That is a significant milestone for our state. And we're seeing a strong representation from across all income levels with the focus on families at below 400% the federal poverty level, which, as a reminder, a lot of the children already qualified for free childcare prior to the inception of universal childcare that was launched November 1st of 2025. So this numbers show that the majority of children that we're helping are actually needing the assistance. And childcare providers need the revenue to continue to support better wages and to grow their businesses. So also on the supply side, we're also seeing successful indicators, including new providers enrolling into providing childcare services. So we sit at 357. And that we see a majority of our infants and toddlers enrolled in high quality centers in 4 or 5 stars providers. So that's also a 67% increase. So this shows that the state, again, it's moving in the right direction. And together, our childcare ecosystem, and we're servicing families and children in vulnerable areas in our state. So we're seeing the impact on the families and the supply, and now on the workforce supply, we're continuing to see promising trends in both completion of introductory childcare training and quorum, which are required for new workforce to enter the childcare labor force. And we're beginning to see children in childcare settings almost immediately. So we're seeing about 48% of our licensed providers that have opted in to the enhanced rates, meaning our frontline providers or workforce or educators out there, our teachers caring for our little ones are making $16 to $19 an hour depending on their start level. So that is huge. We're making significant milestones here in the state. Next slide, please. So in summary, universal childcare is here to stay, and we're paying for childcare regardless of income. So for those supporting families with little ones, this means less stress for parents, more support for children, and our childcare providers. So many of you here today, we have health councils, local collaboratives, early childhood coalitions. I see a lot of you here. They deeply understand the challenges involved in ensuring families and children have their basic needs met. You all are consistently navigating and mitigating the complex stressors that impact children and caregivers. And your work on the ground is really essential in really helping families overcome the barriers of stability, well-being, and opportunity. So again, your dedication provides critical insight to the community needs and really strengthens the system that supports New Mexico's families every single day. Next slide, please. Okay, so any family in New Mexico who's working or going to school can receive assistance regardless of income or immigration status. Minimal documentation is required while the application is being processed. So if a participating child does not have a federally eligible recognized status, the financial assistance will be paid with state dollars, with state funds. To receive the assistance, families must find an available slot with a provider of their choice that accepts childcare assistance in their community. So there's no co-payments again, no gross receipt taxes, or any hidden fees. Next slide, please. So within the child care assistance, there are activity requirements that are waived for certain populations, including grandparents raising grandchildren, families caring for babies born substance exposed, families experiencing housing instability, and families that are involved with CYFD. So presumed eligibility allows families to really enroll into a child care of their choice while their application is being processed. And this helps reduce delays and ensures that the child is placed in an immediate child care to access care almost immediately. So this means that the child care assistance can start right away, and presumed eligibility will not delay any reimbursement for providers that are caring for the care that they're providing. So the eligibility is good for up to 90 days. And again, it's also the responsibility of the parent to submit the required documentation in a timely manner so there's no interruption in services or in childcare support. Next slide, please. So applying for childcare is simple. To find a provider in your community, go to the childcare.eccd.nm.gov. Visit the New Mexico ECCD Child Care Assistance and click on Applying for Services. You can also call the 1-800-832-1321 or sending an email to child.care@state.nm.us. Lastly, for families that are ready to apply, they must have the following documents handy, including current proof of income, birth verification of all children living in the home, verification of education, activities, school schedule for adults, if applicable, government-issued photo ID for applicant, proof of New Mexico residency, and that could be a lease agreement, a utility bill, mortgage, and contact information for the selected childcare provider. So a complete list of all the acceptable documentations, it's at our website. We will post a link as soon as I'm done with my presentation so you all can access and you can share the link and information with your families and your communities. Next slide, please. Okay, so the online steps to apply for childcare assistance are very simple by visiting, again, the eligibility.eccd.nm.gov. Parents must create a user account. A valid email address is required. So the next steps is really to complete a full application and upload all of the required documents. After you submit the application, one of our team eligibility interviewers will review and contact the parent to set up an interview. By completing and submitting this information is not a final determination for eligibility. So additional information may be requested by staff to determine parents' eligibility. So it is important that during this process, parents check the application status on the website, check on the term on presumed eligibility. Again, it's available for up to 90 days. Also, you can check the website if you're missing any documents. You will be given a notice of action and deadline to provide the required documentation. So once all the necessary documents are provided, you will be determined eligible for up to 12 months, and thereafter you will have to renew your application annually. Next slide, please. All right, so let's jump into our supply building updates. So now let's briefly review the infant toddler contracted slots program. This is a program that is critical to universal childcare efforts and also a key supply building in our state. So this has been in motion and in fully implementation mode as of June of 2026. Actively, the program includes 13 approved childcare providers across 6 New Mexico counties, of which we will serve collectively 441 infants and toddlers, including children with developmental delays, families at or below the federal poverty level, and those residing in underserved areas. So this program allows the building supply and prioritize childcare to those who need it the most. And actively, this program is in Bernalillo, Doña Ana, Otero, San Juan, Socorro, and Valencia as we speak. Next slide, please. And the attention to the potential childcare providers that might be here if you know anybody that might be interested in opening their own registered home. ECCD continues to strengthen the registered home recruitment we've been translating regulations into Spanish and updating both the website and application packet to ensure they are easier for providers to navigate. Our team is also collaborating with Wonder School to enhance the registration in the home portal for developing clear and accessible materials, such as we're doing community flyers to support the outreach efforts. In addition, we're updating the toolkit to improve usability and make the process more accessible for prospective registered home providers. So it's available. Next slide, please. Okay. Let's dive now into the Childcare Revolving Loan Fund that provides low-interest loans to New Mexico childcare providers to increase access to quality childcare in our state, particularly in underserved and geographically isolated communities. They are a 2% annual interest loans. It's actually the best rate in our state, if I'm being sincere. The loan itself serves for childcare providers to make improvements, expansions to the childcare facilities, and this is a partnership between ECECD and the New Mexico Finance Authority, in which ECCD determines project eligibility and priority, while NMFA underwrites the loan applications and administers the loans. Next slide, please. Interestingly, this loan has existed for over 20 years. It was actually created by the legislature and then not funded for a very long time. Then in 2025, the legislative session and during the legislative session, the legislature appropriated about $10 million to the fund and expanded and updated its use. And then ECCD created rules around it. So we were able to open our first round of funding this last fall. We opened the application in September, and we had providers from across the state apply to the loan and tell us about their projects and what they wanted to use this loan to fund specifically. So during the first round, we received roughly about 116 loan applications. This was a very competitive process, and we ended up prioritizing 16 projects. And we were very excited because during this 2026 legislative session, we received an additional $10 million to fund round 2 in FY27. And we're looking forward to doing it again, and we're hoping to continue building that supplies in your communities across the state. Next slide, please. Okay, so this next iteration of funding for FY27, the applications are going to be opening September 1st of 2026. And the applications are due October 31st of 2026. And who can apply for the funding? Definitely childcare providers, and that includes private and nonprofit entities, and also entities owned and managed by tribal government. Applicants must be licensed and in good standing with ECCD licensing division. Lastly, the providers must adhere and to comply with all the applicable federal, state, and local laws and regulations. So this is not available to register homes that will want to stay as a registered home. If you're pursuing a licensing and expanding your business, then the loan is for you. The funding, again, can support improvements for repairs, maintenance, and expansion of facilities, the construction of new facilities, and they can be used for operating capital. So the state statute actually indicates that the Child Care Revolving Loan Fund requires that we prioritize funding projects that serve disproportionately high numbers of state subsidies clients and low-income families. So again, the application opens September 1st, closes October 31st. Please, if you know anyone, or if you're interested in applying, please plan accordingly. Submit the application and all the required documents in the application portal and before the deadline to be considered for funding. The CCD will score each application according to the scoring rubric, which said rubric will actually be available on our website here pretty soon. So I'll post the link to the website. And some of the county priorities for round number 2 will be Bernalillo, Doña Ana. Oh, yes, I'm cut off.
Never, Jose, you're never cut off. Continue. We're almost there.
I think we're done. I think we're done. But yes, thank you. If you have any questions, feel free to reach out. My contact information is there. Thank you again, Valeria, for the space.
Of course. And thank you to ECECD, our friends there, and to our legislative body, executive branch. I mean, this is an immense and most important investment, right? Our tax dollars at work. All the information is going to be shared via our resource guide, also via the online hub. Thank you to all the presenters through the breakout sessions, right, for the timely discussions. We are identifying alignment, my friends, and potential collaborations for serving our communities more effectively. We are stronger together. And up next, we want to open up our public health panel, where we are welcoming candidates running for New Mexico's executive branch, the governor and lieutenant governor. Today, we have Mayor Hall with us and Stephanie Garcia Richard, who is also representing Deb Holland. I want to just let everybody know that this panel, the community questions that are going to be facilitated, came from community through county and tribal health councils, CCF members. And as you hear the conversations through this panel, my friends, and you have a burning question, we are welcoming you to please include those questions in the chat. And we would be happy to relay these questions to the candidates for follow-up via the CCF online hub. Today's panel is going to be co-facilitated by Kayla Blanchard, Health Council Coordinator at the Otero County Health Council, and Tracy Cordero, the Health and Human Services Director with San Ildefonso Pueblo Tribal Health Council as well. Over to you, Kayla and Tracy. Welcome. And thank you, Mayor Hall and Stephanie Garcia Richard, for being with us today. We're so touched by your presence. We're 170 community partners together right now. Thank you.
Good afternoon, good morning. Goete hopa kuchinagsicha washpahanechtuta. Kokiteme osuta awe matasa. My name is Tracy Cordero. I'm from the Pueblo of Coach T, and I'm here in the capacity of the Health and Human Services Director for the Pueblo of San Ildefonso. Thank you both and welcome to our panel, to our audience here. We appreciate your time in advance. Today's public health panel is about something we all share, and tying back to the words of Governor Moquino, that's the health and well-being of New Mexico communities. For all, we are bringing candidates together, not for a debate, but for an opportunity to learn more about the candidates' commitments for improving the health and well-being of all New Mexicans. The questions, as Val said, the questions you all will hear will have come directly from communities and health council partners across New Mexico. And our goal is to understand each candidate's vision, priorities, and approach to strengthening the systems that support healthy and thriving communities. Just before we jump into the first question, we'll set some simple ground rules here. We saw some of those debates, so we don't want it to get heated. Each candidate will receive 4 minutes to respond to each of the questions. We're going to ask you to respond to the question rather than one another, and then you will have an opportunity to clarify your position, but we don't want to get into a rebuttal of one another. And then we ask respectfully that you keep the focus on solutions, policy, partnerships, and community impact. Kayla and I may ask you to come back to us if the conversation starts to veer off a little bit. So thank you. And I will lead us right into the first question, and then Kayla will take the next one, and we'll go back and forth from there. You'll have 4 minutes, and you will be timed. Okay, our first question. If elected governor and lieutenant governor, will you be willing to strengthen a state of tribal health in New Mexico, centering tribes, pueblos, and nation government leadership, including and investing in our tribal health councils to work with state agencies, legislatures, and IHS 638 and CMO partners for improving local coordination for access to care and essential services, appropriate data sharing that honors tribal sovereignty, and strategizing with state agencies? Ms. Richard, we'll go with you first.
Thank you, Tracy. I just want to begin by thanking the Health Councils for having us here today. I'm so honored to be able to join you and share the vision of the Holland Garcia Richard ticket for health in New Mexico. So, you know, and you all do very important work, and it was an important landmark piece of legislation in 2019 when the legislature created the Health Councils. In specific, I have had 8 years in the state land office of really working well with tribal governments, tribal leadership, and recognizing sovereignty. I think the same could be said for sovereignty around health. And I kind of see a two-pronged way to support tribal health. The first is to ensure that we are addressing and closing the healthcare gaps on tribal land. And that includes, increasing immunization, chronic disease care, a coordinated effort to disease prevention, education programs, and that kind of funding for those projects. And I know that Secretary Holland is incredibly committed to ensuring that we have better outcomes on tribal land for health. The second way is really through the tribal senior centers. And this, there is federal funding provided for this effort in both the Title VI and Title III programs, the Older Americans Act, and the trying to prevent discrimination to access to healthcare. And so I would really work with the long-term aging and long-term services agency, as well as other agencies, to ensure that we are advocating for that funding, and to ensure that we are addressing things like nutrition, supportive services, caregiving services. I know a lot of folks, in fact, people I know personally, are caregiving for older relatives. We were just caring for my husband's mother for 4 years. We moved in to live with her. And so I know that that is a burden that a lot of New Mexicans, particularly in tribal areas, face. And so I would like to advocate for funding to support them.
Thank you, ma'am. Mayor Hall.
Sorry, let me turn that mute off. Thank you, guys. It's a pleasure to join you here today, and welcome Land Commissioner Garcia Richards. We certainly appreciate you being here too, and thank the Secretary and your team for participating in this, because this is such a critical issue that's facing New Mexico going forward. Just to touch on tribal sovereignty and kind of my perspective of that. Having been the mayor of Rio Rancho for the last 12 years, one of the things that I really worked on was maintaining local autonomy, maintaining local decision making, and really advocating for local communities, including the Pueblos, being at the table when certain conversations happened. And so nobody knows better than I that when the Roundhouse makes a decision or the legislature takes a position on something or passes a law, and the partners aren't at the table, but these decisions get made, we have to be the ones to figure out how to implement them, how to execute them, and what impact they're going to have on our communities. And for far too long, I've seen communities across the state be disenfranchised, including our Pueblos, when it comes to healthcare decisions, when it comes to education issues, when it comes to many of the different things that we're facing across the state. So my approach as the governor of New Mexico will be to bring people to the table before we sign legislation, before we enact policies, to make sure that all of the stakeholders are at the table, because this impacts us all. And I've said this time and time again, New Mexico wouldn't be New Mexico without its pueblos, without its sovereign nations, without the Indian nations that are in this state. They bring such a huge value and rich culture to our communities. So making sure that they have access to the educational needs, the healthcare needs, and working directly with the health councils. I think that this is a tremendous opportunity to continue to build on those health councils, to make sure that the good communication is happening about what's going on in each communities. And while we might have things in common when it comes to, okay, we need healthcare or we need certain individual items, and those might be a common thread. The reality is, in each community, those solutions could look very different. And so what we need to do is take more of a community approach to solving problems on a community level. I've said this not just with the Pueblos, but with communities across our state and our counties. Just in education, for example, I always like to point out the difference between the needs of Espanola and the needs of Los Alamos. Those are two very different communities, but in very close proximity to each other. You're going to have a very different approach to some of the healthcare needs that you have in that community as opposed to what might be up in Los Alamos. So taking that same approach, working with our Pueblos and making sure and our tribal communities to make sure that their voices are heard, and that we're approaching healthcare and the resources that are needed. And that includes funding, and making sure that that funding is available, and making sure that there's ongoing funding for these health councils. For the longest time, it was my understanding that they were either not funded or severely underfunded. And I think that's a funding process that needs to be protected, so that that collaboration continues to continue, and that we continue to provide those resources out there. And we can go into many of the different issues that I'm aware of, that by talking to a lot of different tribal leaders and governors across the state, some of the things that they're facing, especially in infrastructure when it comes to healthcare or just basic quality of life and issues that need to be worked on. And those solutions are all going to be slightly different, but nonetheless important when we look at bringing these services into those communities.
Thank you, sir.
Good afternoon, Mayor Hall and Ms. Richard. Thank you again for being here. For the second question, we'll start with Mayor Hall and then go to Ms. Richard for her response. Your question is, if elected governor and lieutenant governor, how would you navigate and respond to the current federal administration defunding states, universities, and federal grants that implement DEI-related programs, health equity services, and research, along with the recent Office Management and Business Executive Order on new requirements for English only and no use of culture with all federal grants allocated to states?
So my approach to that would be to evaluate each of those programs and see how that we sustain them within the state of New Mexico, so that way we don't have this over dependence on federal monies. Having been the mayor of Rio Rancho, we had to figure out how to fund things on our own if the state money wasn't available and if federal money wasn't available. So sitting down and working through these various different programs, identifying what they cost and what it's going to take to create sustainability in these programs. So that way, when we have a shift in a federal administration, that we don't end up losing the programs because we don't have the opportunity or the ability to fund some of these things on our own. So I think that comes down to really when you think about states and having authority to themselves and not being completely reliant on federal government funds. I'm going to be a big advocate for looking at these programs, working with everybody and figuring out how we sustain them on a state level. So when you do have fluctuations in the federal government, you're not going to see a massive impact or a fall off of services, especially for those individuals who rely on those services, that have a huge reliance on those services. And as we were, listening earlier to the number of people that fall below well below the poverty level, the federal poverty level in the state of New Mexico, I think it's incumbent upon us to come up with those solutions and insulate our state from some of that federal dependence and make sure that we're taking care of our own. So that would be my approach, is looking for the ways that we take care of those issues locally, so that we're not so heavily impacted when decisions are made that are outside of our influence or control.
Thank you, Kayla. So let's set the stage. 40% of New Mexicans covered by Medicaid, 20% of children, over 500,000 New Mexico seniors have Medicare coverage. That is a good portion, more than half of our entire population are heavily reliant on federal dollars for their healthcare coverage. If that's not a vulnerable population, I don't know what is. And at risk right now, when you talk about DEI programs, when you talk about cuts to higher education, are our low-income, first-generation college students. Now, I don't know about you, but I think it's actually the role of the governor and lieutenant governor as the head of the state to stand up to federal cuts, to fight back against federal cuts, to ensure that New Mexicans are protected. And the only way to deal with a bully is to stand up to a bully. I'm just going to be very clear right now. The biggest threat to New Mexicans' healthcare access is cuts from the federal government from the Trump administration. So it's a two-sided coin. A, we have to fight back. We have to ensure that New Mexicans are covered. But B, and as the legislature passed in 2025, we have to ensure that we have the funds here at home to cover Medicaid in case those cuts do come down, because our population cannot afford to lose healthcare coverage. They're too vulnerable. We need to make sure that the bottom line is we are standing up for New Mexicans. As I spent 8 years in the state land office, standing up to the federal government, ensuring that our lands were protected, our environment was protected. And as far as I can see, protecting the environment is protecting health. So I plan to take that same fight to the lieutenant governor's office. Secretary Holland did the same thing as Interior Secretary, ensuring that she was standing up to threats to New Mexico, threats to our natural resources, and we will continue to do that.
Thank you both.
Thank you, Commissioner Richard. That was a good segue, considering some of the demographics you just mentioned now, but also thinking about potential food benefit cuts affecting 89,000 adults, the seniors potentially losing benefits, children and their dependents on SNAP. The question is, if elected governor and lieutenant governor, what would your plan be to protect Medicaid, Medicare, and ensure the renewal of 1115 waivers?
So it's Secretary Holland and my plan to continue what the legislature already started, and that is essentially gap funding to ensure that our Medicaid emergency fund continues, and that's a trust fund of $2 billion that the legislature passed in 2025. Ensure that that is protected, ensure that that continues. The legislature also passed a lot of flexibility, especially around Medicare coverage, allowing seniors to be able to switch their plans from Medicare Advantage to Medicare Basic, and to allow for folks who lose coverage to apply for Medigap coverages. And so just ensuring that those programs remain in place, ensuring that we are committed, have a laser focus around funding for folks who, may lose federal dollars. I think that no one wants to see kids go hungry in New Mexico. And so working with the legislature to ensure that there are dollars to make up for funding gaps from the federal government around SNAP benefits, around Medicare and Medicaid benefits.
Thank you, ma'am. Mayor Hall?
Absolutely. Thank you. Appreciate that question, because it is a critical point when once again we get into a federal administration. We do have to fight back, and we do have to push and make sure that we're getting all the resources that we deserve. And I believe that is absolutely an obligation and a responsibility of a governor to fight for every resource that we possibly can. I've had that very specific experience as a mayor, fighting for resources for our community, whether that's from the state or from the federal government. So when it comes to bridging the gap, I know that the gap funding bill, which did put $2 billion into a fund there, that I think that's literally a stopgap. So in the wake of additional federal cuts, making sure that the neediest in our state are fed and making sure that the elders have health coverage that they need. I think there's a lot of responsibilities here when you look at these various different facets. Another major one is bringing in additional healthcare resources and making sure that we have the doctors and the facilities to support these individuals. And I think that's going to take a state partnership and working together with the recipients of those benefits. So when it comes to the federal government, once again, absolutely, we have to fight for every dollar that we can get. But at the same point in time, when those dollars are cut off or they're not available or for whatever reason we can't access them, we do have to look at some resources that we have right here in the state of New Mexico. We have a sovereign, various different sovereign funds right now that add up to $75 billion, looking at how that we can appropriately invest those to make sure that in the wake of a loss of a federal dollar, is that those can be, that those can bridge the gap to make sure that we're not putting people out of services and that our kids are being fed and that our senior citizens have the health care and the food that they need as well. So the dependence on these programs in New Mexico is very big when you think about the numbers of individuals that are on these programs. But it is, so when you have a deviation in the federal government, I'm going to fall back on the thought that we as a state, as a legislature, have a responsibility to take on that task for ourselves, so that we can make sure that we're providing for the people in our communities.
Thank you both. And just before we move on to the next question, I'm wondering if either of you wants to say anything specific to the 1115 waivers, given how critical those are specific to tribally operated clinics. If not, we can follow up with that, and I'll turn it back over to Kayla.
Right, thank you. And Mayor Hall, I will start with you again. Your question is, so county and tribal health councils are statutory community public health entities under the County and Tribal Health Councils Act, House Bill 137, yet reoccurring base funding has been historically absent and often fluctuates year to year. If elected governor and lieutenant governor, will you be willing to prioritize reoccurring base funding of $27 million in the governor's budget priorities, House Bill 2, for the 33 counties and currently 10 tribal health councils, including a 20% incremental annual increase for the remaining 10 Pueblos, Navajo Nation, and Apache nations to establish their respective tribal health councils?
Yeah, I would absolutely support that. And I've met with some of the leaders in the tribal health councils and really learned how important these individual councils are, not only to the individual communities they serve, but to collaborate and make sure that community-based decisions and statewide decisions are being made. I was surprised to learn that early on, when these statutory councils were put in place, that they weren't appropriately or funded at all. And so I would be looking for ways to make sure that we not only fund the existing ones to continue this ongoing process, but at the same point in time, make sure that there's funding that can continue to grow as we add additional tribal councils across the state. And that way you've got this local community focus that really helps address issues on a local need. And that's why I like the local tribal community councils as they individualize, because they're able to focus on solutions that are very important to those communities directly. You have the overall blanket of needs when it comes to healthcare. We all know that we all need healthcare. We all know that there are services that we all have in common, but I'll go back to the point that all of our communities have very different needs, very different levels of needs. And so making sure that we're working with local community representation to understand the specific needs and making sure that the funding that's coming in it meets those needs on a direct basis, I think is going to be critical to improving the quality of life for the citizens across New Mexico, especially through the tribal communities. So I would be very supportive of that, yes.
Thank you. Commissioner Richard?
So I'll just begin by making our commitment, and this is a commitment from the Holland Garcia Richard administration. Should we come into office, we absolutely commit to double down on healthcare, on health councils. We've talked about the threats from the federal government. We've talked about vulnerable New Mexicans who could lose access to care. And I think this really is where the health councils can come in because of their far-reaching impacts. And because of a lot of things actually that Mayor Hall was talking about. The fact that they are very localized, the fact that they know their communities best. We want to continue their funding. We want to ensure that we are, we realize there is a medical provider shortage in the state. So we want to attack the medical provider shortage by ensuring we have rural residency programs. We have incentives like housing incentives to recruit medical professionals to New Mexico. And so all of those things will be and are part of the healthcare efforts that the Holland administration will deliver if we should come into office. We do see the dire need in New Mexico, and we see the role that health councils have provided in ensuring that folks, particularly in tribal and rural areas, have to access healthcare. We want to continue the support for them, and you have my commitment here today to do that.
Thank you both.
Okay, and for our final question here, and my favorite topic lately, if elected governor and lieutenant governor, would you expand and sustain the SB3 Behavioral Health Reform and Investment Act of 2025 beyond the current funding period of 3 years?
So we were at a critical period in our state before the legislature passed SB3. And that was due to the actions of a former governor who essentially gutted behavioral health services in New Mexico. And for anyone who is New Mexican, you know that our population struggles with addiction, mental health, behavioral health. And so having that dearth of services really impacted us and severely impacted us. So the fact that the legislature came in to create a program to really address that need in New Mexico, and by the way, the program is incredibly similar in its locality to the health council legislation. It relies on that same notion that the folks in the local area know best for their population. It's unfortunate that SB3 was a partisan bill. It did not get much bipartisan support. So I'm hoping that as we move forward, we will get more bipartisan recognition of the mental health crisis in New Mexico and the fact that we need to address it through resources. The best way to impact things like public safety, crime, is to ensure that we have robust wraparound mental services. And so that is something that New Mexico really struggles with. I know that Secretary Holland, she has had experience with that as well. So that is something that she is really wanting to ensure that this administration is committed to addressing.
Thank you, ma'am. Mayor Hall.
I agree. This issue and this funding from SB3 shouldn't be a partisan issue at all, because especially when you're dealing with the tribal governments and in the health councils, the first thing I would do is pursue giving the tribal councils a direct role in the decision making in this particular area. Because once again, this is an area where a lot of voices are left out as the legislature makes decisions for not only local communities and counties and tribal governments, and not really addressing some of the systemic issues that are directly in the communities. So making sure that funding is available and that these programs are actually doing what they're supposed to be doing. I think SB3 is a critical tool to, advancing behavioral health issues, and working with our communities to make sure that we are solving those issues right there on a community level. And so I think of all the various different areas that we've had to deal with in our community with child youth health issues, child youth behavioral health issues, child youth drug addiction issues, and all of these different things that really feed into this particular bill. I think it has to become a priority, because our state is slipping further and further and further into some of these deficiencies that if we don't make it a priority going forward, we're going to continue to see a rapid decline. And so I would be in support of making sure that we have the funding and the resources to really pick up on some of these managed care organizations, and working with, once again, the tribes to make sure that we're working to support those health councils, because I think that's where you can really tie SB3 into creating a collaborative community approach that listens to the needs of communities, but also supports the total overall program as a whole. So that would be my approach. But this is, once again, as governor, going to support the SB3 bill and the funding here, because I think it's critical to the state of New Mexico. When you see some of the issues that we are dealing with, I think one of the big things that we look at is, like right now, some of the opioid issues and behavioral health issues that feed into all of that. Making sure our communities are resourced not only with dollars, but the expertise and professionals necessary to help implement these programs. Because sometimes government's good at maybe throwing money at something and then not really being the partner that they need to be to make sure that those resources are implemented and funded in a way that really deliver genuine results. So that would be my commitment, not just from a funding level, but from a participation level that really shows that I will be actively involved in making sure that we get the results that we need and our communities are directly benefiting from this program.
Thank you, Mayor Hall.
All right. Well, thank you to all of our candidates, and most importantly, thank you to the county and tribal health councils, tribal partners, and community members who shaped today's public health panel questions. Our hope is that this conversation strengthens understanding, accountability, and partnership as New Mexico moves forward. The health of our communities is not a partisan issue, rather it is a shared responsibility. And meaningful progress requires all of us to listen, collaborate, and work together for a healthy and thriving New Mexico. Thank you, everyone.
Thank you.
Thank you, Commissioner Garcia Richard and Mayor Hall, for the very robust public health panel, and to our facilitators. I want to invite, there's about 155 community partners strong. I am including the CCF online hub link. I know both of you are registered, Commissioner Richard and Mayor Hall. There's so many great and important community questions that have been populating the chat. This is such a great opportunity to continue that engagement with, constituencies statewide. So we invite you both, the candidates, to join this space and continue with that dialogue. So grateful to both of you. Thank you so much for making time today.
Thank you.
Thank
you for having us.
Thank you. Thank you, Madam Commissioner. Appreciate you.
Thank you, Mayor.
And now, my friends, once again, we have a very important call to action in support of our communities, ways that we can all participate with relief support in support of Pueblo of Zuni with the recent flood. We're going to drop this information in the chat as well. Pueblo of Acoma has been a tremendous support partner to Zuni Pueblo. They are accepting donations up until tomorrow at Sky City Casino Hotel in the lobby area, exit 102 off of I-40 going west. And also, just given the impacts from the Frijoles fire, we have some information here for affected communities to please stay informed. Pecos, Santa Fe, Pueblo of Nambe, and surrounding areas, please stay informed. We have fire information via email, phone number, Facebook, and also online. So please, let's link arms, my friends. We're going to go on to our next slide. As we begin to, sort of wrap up this timely CCF, we want to invite you to a couple of resources available to all of you at free. We are going to be hosting an advocacy training November 6th, so mark your calendar. And we're also, through the New Mexico Alliance of Health Councils Board Advisory Committee, we're hosting our kickoff meeting August 25th, next Tuesday. And this is really an invitation to advocacy partners, community partners, anyone and everyone who wants to collaborate on supporting public health policies that serve our communities in really, really meaningful ways, and to learn about what's going on, right, in public health advocacy and emergent policies, as we heard today from our friends at New Mexico, Think New Mexico. And so we're also going to include these URLs into the chat. So we'll keep that open here for a minute. Your feedback is so critical to curating these CCFs. This is your space. This is our space together, my friends. And so if you could kindly include in the chat or here in a little bit when Sam launches a little Slido link, let us know what's important for you coming into November as we're wrapping up the interim session, right? Goes through December, getting prepared for the legislative session, getting prepared for a new year. What would be most important for you, right? For CCF members to come together, stay informed, discuss, collaborate. And so here we have the survey link on the right-hand side, and on the left-hand side is the link to the online hub. This is where you can reach partners in your region, right? Northeast, Northwest, Southeast, Southwest, statewide as well. Find out who's closest to you, working on what specific priorities. And once again, a big shout out to all of our CCF facilitators who held and co-facilitated today's convening together. Kayla Blanchard from Otero County Health Council, Tracy Cordero from San Ildefonso Pueblo Tribal Health Council, Emma McKinley, Grant County Health Council, Sam Winters, Socorro County Health Council, Jessica Osenberg, Roadrunner Food Bank throughout New Mexico, and to our presenters, Think New Mexico, Project ECHO, New Mexico Healthcare Authority on SB3, New Mexico Early Childhood Education and Care Department on Universal Child Care, candidates running for executive branch, governor and lieutenant governor, candidates Deb Haaland, Commissioner Garcia Richard, Senator David Gallegos, Mayor Hall. Thank you for taking time out of your busy schedules to be with us today, and to the CCF planning team as well. I hope that we leave today's CCF not just with ideas, but most importantly, with new connections, with renewed energy and a commitment to act together, my friends. We have the relationships clearly. We have the knowledge, the expertise, the wisdom, the resources, and the lived experiences to make a difference, right? So let's continue to break down silos, connect, align, share resources, lift each other up, and turn collaborations into action. Let's link arm, my friends. collaborate boldly, and keep showing up for the people and communities that we serve. Thank you for being part of this collective effort. Until next time, please take care of your precious selves and each other. And if you could just share one word, what you take away from today, how today supported you, inspired you, please share it in the chat. We would really appreciate that feedback. We're so grateful for you. We see you. We're here with you and for you. Thank you all so very much. All right, and a little reflection: hopeful, fam, informed, motivated, gratitude, me too, hopeful, inquisitive, collaborative, feeling unity, encouraged. Know that the Alliance is here for you and with you. Know that CCF is here for you and with you. Thank you, my friends. Take good care.